Anderson, 3 Franklin Avenue. I've had this issue come up before, and it concerns the item G on the agenda tonight. Can't hear you. Closer? Better? I'd like to stand up, but I'll lean over. I'd like to say that part-time employees should not receive benefits from the village. As per your current proposal, Mayor Wigman should not receive a benefit as a part-time mayor. That being said, I have some questions for Trustee Slippin, an appointed trustee who must have reviewed the ACA policy, the village code, and the village website, as I have. This is an open forum that allows a free exchange of ideas and views, and per your recent Gazette letter, I think it's appropriate to discuss now and not 3 weeks from now, since you will be voting on this issue tonight. The minutes of the April 11, 2011 Village Board meeting state that Mayor Wigman replied that the village board members are eligible for the retirement plan, but no pension retirement benefits or health care benefits. Village Manager Zambrano added that the board is not entitled to benefits because they are part-time. They can opt to pay into it, but they would have to pay the full costs. The current policy indicates the mayor is not an employee. He is a part-time mayor, something he signed up for as a public servant. The board members are part-time positions. Do you feel he is entitled to this benefit? When you reply, I'd like to know why you believe the mayor should appropriately be considered a full-time position. The mayor was never authorized either by resolution of the board or any other means to work full-time hours and obligate us to pay for his benefit. I can't believe any other village employees would be allowed to self-report their hours. Is this in place only for the mayor? The mayor claims that for each week between January and September of 2013, he spent 7.5 hours per week answering emails with residents and 2.5 hours per week on the phone with residents on average, with no oversight. I've never seen proof of these email exchanges or phone calls. What's more, as of August 22nd, 2014, according to the village clerk, the mayor has not reported any hours for the year. Do you think the mayor will reconstruct some hours to meet this requirement? Will anyone know what occurred? When you reply, please tell me whether you've seen documentation of the mayor's full-time hours, either for 2013 or 2014. Legitimate questions have been raised in many forums as to the mayor's eligibility for this benefit, including Mr. Resnikoff, who has never been answered by the board or Mr. Zambrano. When you reply, please explain why the board is providing this benefit and why Mr. Resnikoff has never been answered, even though he is a registered Democrat. Finally, I'd like to remind you that there's a handsomely paid group of 4 people who conduct the business of the village. The village manager at $170,000 plus benefits a year, an assistant village manager with another 6-figure salary plus benefits, a full-time clerk, and a full-time deputy clerk. This is a village of 8,000 people, 2,000 families. When you respond, give me your justification for adding a full-time mayor on top of this. So I ask you, Trustees Slippin and Galelli, what are your plans for the future? Will you be seeking health benefits from the village? The Croton United slate pledges not to seek or receive any benefits from the village. Trustees Galelli and Slippin, will you make that same pledge tonight? Here. The floor is yours. Thank you.
I just want to point out that this is not a political debate, and it's not a place for political grandstanding. We're in a place for political grandstanding. I would point out that you've chosen not to attend the scheduled political debate, and you're trying to instead engage in that here, which is highly inappropriate. But of course, this isn't the place for that.
This is an open hearing. Ms. Slippin wrote the letter. It's in this Gazette. I'm here. It's an open forum. This is a discussion we can have.
This is not a place for you to interrogate board members. It is a place for you to offer your comments. You've done that.
It is not. It
is a place.
I'm sorry.
It's an agenda item.
Yes.
It's not a political question. It's item G on the item. on your agenda. I'm here to speak to you
Then
about
why
it.
did you only address it to trustees Slippen and Galelli?
I'll tell you why he addressed it to me. I'll tell you why he addressed it to me. I'm spectacularly flabbergasted by your presentation, but I'm happy to entertain answering your question in the way that I want to answer it, since this is not a moderated forum. We had a wonderful, lively, extensive discussion with the ACA consultants at the last work session, and was actually quite disappointed to see that none of the people who have been questioning it extensively bothered to come to a place where they could actually get questions from people who could actually answer it with precise accuracy. The policies are put together and the decisions are made based on the recommendations of the experts that are brought in by the employees of the village. So you decided not to come to that and to prepare a fantastic little statement to me, the person who is your opponent in the upcoming election. So thank you for singling me out. That's wonderful. I am not going to accept, I didn't write your questions down because actually I kind of started to, they're just not the point. Yes, you put me on the spot in a way that's very uncomfortable, but I'm not going to, it's just inappropriate. It's inappropriate, and I would love to discuss it with you at the League of Women Voters Forum, which is the appropriate, or another forum, which is the appropriate spot for this, but not at a village board meeting. Now, if you have an actual question for the entire Board of Trustees and the mayor, or any of the other staff that is here tonight for the entire village, that would be fine. But I do think that this is an unfortunate choice to try to pick on two of the candidates.
It's your opinion. You wrote the letter. I came to respond. I don't believe the mayor should be receiving this benefit. That was a simple question. You can address it to the whole board. You can take it as a personal thing, but you were the one who wrote the letter. That's all this is about.
Thank you, Mr. Anderson.
Mr. Anderson, this is not about letters to the Gazette or any other place. This is about items that are on the agenda, and opportunity for you as a resident citizen to come up and tell us your comments on it. It's not an interrogation, and it has nothing to do with what anybody wrote in any other place outside of this meeting place.
I should point out that the agenda item that you commented on, are commenting on, is a requirement by the village or any organization to adopt specific policies for each fiscal year of the healthcare, 2014 and 2015, about procedures and policies. These procedures and policies are laid out in the 60,000 pages of the document, of the law, and our consultant is helping us navigate through that for an organization of our size. And so therefore, we have a mandatory step we must take of adopting the policies and procedure plans for healthcare for the village for 2014 and 2015. And that's the only thing that this resolution represents. We didn't make any of this up. We're trying to follow the guidance of the expert as to what the interpretations are of the federal law.
I read that. I understand. It just appears to me that we're playing with part-time versus full-time and benefits, and I just was not clear.
All of which is based on the Affordable Care Act's interpretations, and there's nothing we can do about that. We can't change that.
Mr. Anderson,
Only Congress can change that.
I think you raised good substantive points, and I think in the future it's best to address it to the whole board, because I certainly am sympathetic to a lot of what you pointed out.
Thank you. Thank you very much.
Rick Turner, Truesdale Drive. Just as a follow-up to the last speaker, I would disagree with Trustee Levitt and Galelli and say that this is an open forum and that citizens should be encouraged to come forward and maybe not to single out individuals, but encouraged to express their opinions, particularly on agenda items, and the board has an affirmative obligation to respond. I have heard these public hearings before where the the presiding officer or deputy mayor would simply say, we're here to listen. No, you're not. You're here to give answers. If you can't give answers, you got to go back and get them. That's what a public hearing is about.
This is not a public hearing, and Mr. Turner, you yourself, since you raised that, and you're very experienced in government law.
Will you
and-
stop the clock? Thank you.
Yes, please do stop the clock. However, you could go straight to Bob Freeman at the Open Government and ask him about citizen participation in village government meetings, and his opinion is that it's an opportunity for people on a limited basis to come up and speak their opinions on items that are on the agenda or off the agenda, depending on when it occurs. That he further thinks that it's should be limited to 3 minutes. That's his recommendation, as is the recommendation of NICOM. And he would disagree with what you just said. This is not an open forum. It's an opportunity to offer your comments, and that's the opinion of the director or the chairman, I forgot his title, of the Committee on Open Government, New York State.
Well, I suspect it's a lot more nuanced than that, and I have made several points here. So exactly what Bob Friedman agrees with and exactly what he disagrees with, I would have to go to Bob Friedman and discuss
I would wish you
but
would,
my
but
point
you know
here
better
tonight
than that.
is that the board has an affirmative obligation to answer citizen questions, and you don't, and that's wrong, morally wrong. I want to...
Now therefore be resolved that the Village Board of Trustees hereby adopts the 2014 and 2015 procedure and policy plans outlining employee eligibility for health care coverage provided by the village.
Thank you. Is there a motion for the adoption of the 2014-2015 policies and procedures for healthcare?
So moved.
So moved by Trustee Levitt. Is there a second?
Second.
Seconded by Trustee Slippin. Discussion. Again, this was the subject of a relatively lengthy and quite informative exchange with our consultants at the last, was it the last work session? 2 work sessions ago.
I can't remember, but I just wanted to offer one clarification on the main difference between the 2014 and the 2015 policies. As was pointed out, the 2014 policy says the mayor is reasonably expected to work 30 hours a week, whereas the 2015 policy provides he's a variable employee, which means it's uncertain. And the reason for that, as I understand it, based on the discussion with the consultant, is that we have data. I mean, we're in October of 2014. We have data for 2014 that the mayor has worked more than 30 hours. We can't adopt a policy for this year that's contrary to that data. Now, people can raise issues with the data, but that's a separate question. The data that we have at this point doesn't permit us to have a policy that is contrary to that, whereas for 2015, we don't have that data, and therefore it's unsure, and that's why the mayor is considered a variable employee for purposes of that policy.
Honestly, to chime in, and I have all respect for the position of mayor and the amount of hours that are put in, but I think that all elected officials should not work full-time hours. We're part-time elected, and I just wonder why it says all trustees will work 25 hours per week or less. And I personally think it should say all trustees and the mayor will work 25 hours per week or less.
Well, I mean, my understanding on that is that, and this is what I gleaned from the conversation with the consultant, is it's not a requirement that we work 25 hours or less, but the anticipation based on whatever factors, just the nature of the job, empirical evidence, whatever, is that we will, and that because we are considered that way, the policy permits us to say that we're part-time from the ACA standpoint, and therefore we're not required to engage in all the different record keeping and things like that. We don't have to record our hours, this and then the other thing. For the mayor, because we have the empirical data so far, you can't classify a job that has been full-time for ACA purposes as part-time. I think then you risk getting into a situation where you're basically, it's based on the larger universe where you don't want to deprive somebody of a benefit to which they're entitled. So I don't
One
think
way to prevent that issue from happening is for everyone on this dais to agree to not work more than 25 hours. And it's not so much, they have the right interpretation, this firm, and they've done a professional job. I'm just saying, from a philosophical and value statement, I personally disagree with that.
Well, the
I don't think it has to do with this policy, though. That's a separate question.
But this policy, I think, justifies it.
This policy,
Sure, I agree with that.
this policy meets your needs for 2015, Trustee Davis.
I know.
Yeah, I really don't think it. I don't see it as justifying. I see it as taking into account what has gone on to date, and the way you have to. You can't sort of. You can think what you want about the hours they have submitted, but you can't pretend that they weren't submitted at this point. And that's how I at least interpret this policy. Leo still required to record the hours, and I say Leo, but the mayor. That's the only person that this is an issue for at this point, and is still required to report the hours, and either if it's 30 hours, it gets it, and if not subject to all the look back periods and all that stuff we discussed at great length at the work session. So, I think that the adoption of this policy, as I see it, is separate from the philosophical question of the mayor taking health insurance. At least that's how
I thought that too initially, and then I reread it, and I'm very uncomfortable with having mayor and trustees treated, not unequally in the policy. We are elected to be part-time. Anyways, point given.
Thank you. Any further discussion? All those in favor of the adoption of these policies as required by law?
Aye.
Aye. Any opposed?
Nay.
One opposed. Thank you. The motion carries. Thank you, Trustee Davis. Trustee Slippen, anything to report?
Yes, thank you. I would just like to talk for a couple minutes about, he was mentioned earlier, but when I was appointed to the term that I'm serving right now, I had done a lot of other community-related or community service type work. However, I didn't have a lot of experience in this type of municipal government. So I've spent, over the course of the last several months, a decent amount of time talking to Bob Freeman in the Open Government Office. And in spite of what goes on in our meetings and the expressed displeasure of some participants, our meetings are far more available to the residents, and there is a lot more encouragement and acceptance of resident participation than there has to be. The amount of time and the frequency with which a attendee at a meeting can participate is, in Bob's words, excessive. The amount of time that they are given to speak is, in Bob's words, well, I'll paraphrase what he said and just say again that it's excessive.
I guess he isn't a champion of open government, then.
The open government doesn't have to, it shouldn't be a free-for-all. It should be an exchange of ideas. It seems like a lot of research, the same way that we do a lot of research to prepare for the meetings, and then we engage in discussion. A lot of research could be done on the part of participants instead of just coming and reading a prepared statement that may or may not be actually something that they even think or wrote. So that being said, I'm, as a resident of Croton, grateful for the openness of the meetings here compared to other municipalities within the state of New York, as has been described to me by Bob Friedman. So thank you, Bob.
Thank you, Trustee Slippen. Trustee Gully, anything to report? I will simply say the following, and I've said this repeatedly. In the past, when hours were reported, the staff essentially, in past years, because I'll speak for myself, I didn't report my hours to the staff,
Right.
that they picked a number, and it was whatever it was, 4 hours, 7 hours, 8 hours, I don't actually know. And finally, in 2013, those managers said, Leo, give us a full accounting of your hours because we know it's higher than what we have been reporting in our annual roll-up to the retirement system. So I did that. I did it again in 2014 for the first couple of months, and then the treasurer asked me to do it through the end of May, and then she asked me to do it to the end of June, and July, and August, and September.
So the hours reported to the retirement system were not self-reported as the form says they are? Is that what you're saying? They used to, when you used to report only 4 hours per
Unless a
month?
trustee, unless an elected official submits a calendar, we report what at that time had been set up as a standard day for each elected official. So
When you,
And so now do you report your hours contemporaneously?
the treasurer asked me to submit at the end of every month.
But those,
Then why
those
on-
out, just, let me just be
No,
clear.
I'm sorry.
Okay.
My question is to the mayor. She asks you to submit them at the end of every month. Okay, that's fine. But as of August 22nd, 2014, none had been received by the village for the hours that you reported in calendar year 2014.
She asked me in the beginning of September to report everything through the end of May, and then to report at the end of September, everything through the end of September, and to do that monthly from there on. Because we had just met with our healthcare consultants, and we were just at the retirement system, so we're learning all this stuff. And the
So are you
format
still
of the calendar
reporting your
keeps
hours
changing.
retrospectively?
So now I have a format that we use, that all the employees will use,